Good morning, everyone. Allison Carlson here talking about health, chiropractic, nutrition, exercise, and today we're going to talk about asthma. Comment below, first and foremost, #live. If you're watching live, wave, say hi, let me know any of your health questions, challenges, let me help you out. If you're watching the replay, #replay. It's just nice to see your comments, see you guys coming and saying hello, and honestly, use this time to help yourselves. It's a free chance to ask questions. So we have a really good lineup. I have a good list going on, but whatever ails you, I will just add it onto the list and see what I can do to help. So today we're going to talk about asthma. So asthma is a usually it's a hereditary condition, and it affects breathing. Usually it's diagnosed in kids before the age of 5. And it can be triggered by a lot of things. It could be, exercise-induced asthma. It can be induced by allergies, so like environmental triggers. And so a lot of times, I feel like you hear about it a lot with kids in sports. So like I said yesterday, I played a lot of sports growing up, played in the backyard. We had a ton of kids in our neighborhood, and I was allergic to trees, grass, mold, dust, and then I also ran around and played sports. So there were often times that I showed up at home wheezing, not being able to breathe, and my mom's like yelling to grab the medicine and do all these things. So there is a condition, or it's not necessarily a condition, but it's kind of a posture that's called Pottinger-Saucer. So Pottinger-Saucer was named after it's like a 19th century British physician, and his last name was Pottinger. And so what it is, so in between your shoulder blades, so your scapulas, you have this like dishing of the thoracic spine. So I know that's a lot of like chiropractic speak, but basically you have this like rounding of the shoulders forward, your back goes backwards a little bit. So we have this like dish in there. Okay. And so the theory is with chiropractic and asthma is, so a patient is exposed to whatever their trigger is. Remember, I talked about it can be an allergy response, it can be it can be like exercise. And what happens is when you have this posture, it creates pressure on the rib heads, and so we have less movement and less ability for the lungs to inflate. Okay. Now, something happens with asthma where we get a spasm in the bronchioles. So like the tree that holds the air, we get spasming in there normally when you would think that you would get dilation, right? Because this is like a fight or flight response. You can't breathe and your body would open up, right? Because our body knows what we need. But with asthma, you get this constriction, but we're still bringing in the air. Our lungs are trying to get rid of it. So our lungs start producing mucus, which is why asthma patients, that's where you get that wheeze from, right? So one of the theories that I talked about is the Pottinger-Saucer. So it's the posture of it. And think about it this way. So if you sit up really straight and you take in a deep breath, I want you to do it with me. Okay, go. Okay, so when I do that, I can feel the air. I can feel the inflation to about here on my torso. I'm kind of like right above my belly button. So I'm like right at my diaphragm line. Now, if I slouch forward and take a breath in, I mean, that got to like right here. Okay, so just think of it that way. If you have that posture, we just can't inflate the lungs. The lungs aren't able to work the way that they're supposed to. But when you do that all day long, we're just more prone to those triggers. Now, the other thing that they're saying in the research that needs a little bit more information is about that fight or flight response. Remember? So with asthma, you have this constriction response where physiologically people without asthma would have this dilation, this opening up of those airways. And so the other question is that is it a decrease or a reduction in that fight or flight response, which chiropractic has been proven to help with that fight or flight response because we're aligning the bones in the spine and we are allowing the information from the nerves to get out to the body and the body back to the nerves and up to the brain. So our body is able to identify those triggers quicker and decide what to do. Okay, so the adjustment isn't getting rid of an asthma attack, it's not curing the asthma, it's just helping with the posture to help with the just to be upright so that the lungs have the space to do what they want, and it's also helping to improve that fight or flight response. So on top of that, obviously, there's a lot of supplementing to do with patients with asthma, specifically to support their immune system, because your immune system controls your allergies, right? And so we're going to talk about those immune system supplements on a later video. It's a great thing coming up with fall and cold and flu season coming up. So every year, my family, we always start ramping up those type of supplements. So, but we'll cover that on a later date. So, I hope this helps. I know that you guys all know somebody with asthma, and share this video with them, give them some tips, and let me know what else ails you, and let me know how I can help you guys out. Have a great day.